Welcome to the 2021 Grant Seekers Meeting. We are extremely excited to inform you of the Winnebago County Mental Health Board application process. As a result of the voters approving the half-cent sales tax referendum for mental health and substance abuse services, the Winnebago County Mental Health Board can approve up to $8.8 million for mental health and substance abuse services. The funding cycle is from June 1st, 2021 through May 30th, 2022. We are very fortunate to have a very committed board. Members include Mariana Body, President, Dick Kunert, Vice President, Dr. Reverend K. Edward Copeland, Treasurer, Danielle Angelari, Secretary, Dr. Terry Giardini, Dr. Bill Gorski, Dr. Julie Morris, Timothy Neighbors, and Linda Sandquist. We also have two advisors, Wendy Larson-Bennett and Jay Ware. I would now like to introduce you to Jason Holcomb, the Community Health Consultant for Region 1 Planning Association, serving as staff liaison for the Winnebago County Mental Health Board. Jason is managing the process the Winnebago County Mental Health Board is using for fund proposals. Jason?
Thank you, Marianne. I will briefly review some of the most critical documents that will help you to apply for funding. All of these documents are linked at the Winnebago County Mental Health Board's website, which is at www.r1planning.org/WCMHB. First of all is the Notice of Funding Opportunity. The Notice of Funding Opportunity describes the critical elements and eligibility requirements for this particular funding year. To highlight who may apply, nonprofit corporations may apply who are registered under Section 501c3 of the Internal Revenue Code. For-profit businesses may apply, including sole proprietors and LLCs. Hospitals and healthcare organizations may apply, including federally qualified health centers. And government entities and departments, including departments within Winnebago County government, may apply. It should be noted that any organization applying must have been in operations for at least 3 years prior to applying for funding. And I will also note that not each of these categories are mutually exclusive. For example, a hospital or healthcare organization might also be a nonprofit. Outlined in front of you, you will see some key deadlines for this process. First of all, today, January 13th, the application has opened and you are seeing the Grant Seekers meeting, which is now posted to the YouTube page. In a week from now, on January 20th, there will be an information session that will be open to anyone who registers to ask questions and answers about the grant application process. And there will be a second information session on January 27th. On February 24th, the grant application will close at the end of business at 5:00 p.m. Central Time. And that will then start an evaluation period, which will last through April 14th, in which time the board will be reviewing applications, scoring, and making ultimate funding decisions. Funding agreements will be reviewed and signed by funded agencies by April 30th, and public announcements will be made on May 3rd. The program year or funding cycle will last from June 1st of 2021 through May 30th of 2022, and there will be quarterly reporting deadlines during that time. Maybe one of the most important documents in all of this is the Mental Health Board's 3-year strategic plan. There was a lot of research that went into the development of this plan, and I encourage you, as with the other documents, to go on the Mental Health Board's website, download the plan, and review it in detail for yourself. I'd like to note that much of this strategic plan was really guided and done through the lens of the community support system framework. And I'd like to introduce to you Dick Kunert, who is the board vice president, to speak a little bit more about the community support system.
Thank you, Jason. And thank you everyone for attending this session and giving consideration to being a part of all of this. The committee I'm talking about that even put together the campaign to pass a referendum for the half-cent sales tax. We adopted early on the community support system because it represents, in our opinion, what continues to be best practice in this field of mental health and addiction. This community support system is not new, but again, on continued basis of research, it continues to show itself as being the best concept for putting together a community system of an array of services. The 10 services that are, as you see in this graphic around the circle, and then case management. So these 11 services are seen as being important in being able to assess, to treat, to begin work on rehabilitation, and finally support for people in our county who are suffering, both children and adults who are suffering from serious mental illness and or addictions. So this is what is going to form the basis for our setting of priorities. And Jason will tell you more about the scan that we developed to do the study within our community and what the outcome of that study has been. So, Jason?
Thank you, Dick. Through rigorous research and community engagement, the board was able to identify 6 priorities, which will be the focus of the next 3 years. Please review the plan. It is critical to understand how much this was informed by community members, and particularly those who live with serious mental illness or significant substance abuse disorders. For each priority that is identified, you will see service areas, so specific types of services that fall within that priority. You will see target populations, specific target populations that will be the focus within that priority. You will see system capacity outcomes, which are more generally focused on the improvements for the organizations that provide services, and then ultimately individual and family outcomes. So how does the improvement of the system impact and benefit the individuals and families who live with serious mental illness and significant substance abuse? And ultimately, how that affects us at a community level as a whole, and what are the community level outcomes that we want to see from these improvements. I will not go through every bullet point here in detail, but I encourage you once again to review the strategic plan, and there are definitions for each one of these service areas, target populations, and intended outcomes outlined in the plan. To highlight the priorities, priority number 1 is mental health treatment. Priority number 2 is case management. Priority number 3 is crisis response services. Priority number 4 is family and community support. Priority number 5 is client identification and outreach. Please note, priority number 5 will not be the focus of funding for program year 2022, this upcoming funding year, but will start in a year from now for the program year 2023, as is the same with priority number 6, housing. The Mental Health Board also developed a funding policy to guide the process and funding decisions that will be made over the course of this application process. This is a long and detailed document that I once again encourage you to download and review. However, I will highlight a few of the key points from this document. First of all, in addition to the eligibility requirements that were noted earlier, an additional note in both the board's bylaws and their funding policy dictates that no staff member or board member of the agency applying for funding will be allowed to serve as a voting member on the Winnebago County Mental Health Board. What that means is if a board member or an employee of your agency is a board member of the Winnebago County Mental Health Board, you cannot apply for funding. A list of disqualified agencies can be found on the Mental Health Board's webpage. If you have the intention of applying for funding, but find yourself on the disqualified list, I would encourage you to reach out to the board member with whom your organization is affiliated to discuss that issue with them. Administrative requirements. Services that are funded by the Mental Health Board shall not be denied based on a client's inability to pay. And participation in a learning network collaborative will be required by all funded agencies, and we anticipate that to take place on a monthly or bi-monthly basis. In terms of fiscal expectations, a few things I'll highlight are that anything over $3,000 of movement within the budget during the funding year will require a budget amendment that needs to be approved by the board, and any indirect expenses need to, as part of the proposal, should be accompanied by a cost allocation plan that describes how that particular percentage of indirect expenses was arrived at. Cost allocation plans that have already been approved by a federal or state funding source may be acceptable for this purpose. In terms of the decision process, there is an evaluation rubric, which we'll review a little bit later in this presentation. But just so you know, a quorum of board members will review all grant applications and score them. All board members will have access to reviewing every part of every application, but at least a quorum will actually score the applications. Scores will then be presented to the entire board for review and discussion at a regularly scheduled board meeting, and a special session will be scheduled for final decisions. It is the intent of the County Mental Health Board not to consider out-of-cycle funding. So please, if you are looking for funding from the Mental Health Board, please apply in this grant application for this funding cycle. In terms of types of contracts, the board will be awarding and entering into standard grant contract agreements with funded agencies, which will dictate and require quarterly reporting. Payments will also be made on a quarterly basis unless requested otherwise and approved by the board. It will require budget reconciliations at the 6-month and 1-year mark, and any expenses that have not been made, any revenue that has not been expended will need to be returned to the board. And I should note that renewals of contracts year to year are possible, but not guaranteed. It is the intent of the Mental Health Board to fund programs, maintain programs over multiple years in order to maintain a community support program. But once again, those decisions will be made year by year and are not a guarantee in any way. Contract amendments, if needed, need to be requested to the board president and will be approved, denied, or presented to the entire board based on the president's discretion and review. In terms of reporting, as I noted, there's a quarterly reporting requirement. There's also financial reporting and program reporting that will be expected at the end of the program year. Okay, here's the part that everybody's been waiting for. I'm going to now get into the grant application portal and show you how to register and how to get online to file your grant application. The URL or web link here is www.grantinterface.com/home/log-on ? URL key equals Winnebago. Please bear with me as I enter a new screen share to get into the grant. So here I am now on the web page that I showed you the link for. And as you'll see, I've got my email address and password already entered. You will need to come in and create a new account by clicking this new account button and follow the prompts. There are some instructions here for you on the right-hand side to help you and assist you with that process. There are also tutorials, both written and video tutorials, to help you navigate creating an account and then entering the grant portal. Please review the tutorials prior to reaching out to the Mental Health Board with questions. Should you have questions after following the tutorials, if you're still having issues, please feel free to reach out. So I'm going to log on, and once you come in here, you will see that there is basically our notice of funding opportunity is copied and pasted in here, so you have that for easy access. Then you can click on this button here to apply. I'm not going to do that. I'm just going to preview the application so I can go through that with you. In the preview portal here, you can click on this question list button here, and it'll actually give you a PDF. Let's just show you that there, an entire PDF version of the application. If you're wanting to share that internally within your organization with other people who are working on the application for you. But please note the Mental Health Board is not accepting paper responses. So this is only for, as a resource for you, this is not meant to be an alternative way of filling out your application. All of the documents that have been reviewed in this presentation are linked here in the acknowledgements. And once again, I not only encourage you, but it is also a requirement of this application process that you acknowledge that you have fully read and understand all of these documents. Please fill out the information for your Chief Financial Officer, including their title. That is not a trick question. We understand that different organizations have different titles for their Chief Financial Officers. In terms of your agency description, there are some instructions here for nonprofits who are registered in GuideStar. You can use your GuideStar profile to copy some of that content into the application. That's of course not required, but a resource for you should you choose to use it. And I will also highlight the risk management plan or policy. I understand that not everyone may understand offhand what that means in the context of mental health services. So we have provided a brief summary for you of some best practices and research that describes what risk management plans and policies should cover in the context of mental health and substance abuse services. If you do not have a risk management plan, that does not disqualify you from services, but we do ask that you explain to us why you do not have one. And I think it would be encouraged that you explain how you are mitigating some of those risks that are noted in that summary document. Agency information. Much of this has already been covered in the presentation, so it's just an opportunity for you to provide some evidence of, for example, the length of time in existence, a recent financial audit, or a recent balance sheet, or revenue expense forms. If you are accredited, please include what accreditations you have and upload copies of those accreditations. And we do ask that you include your profile of board members, a list of your board members. If you are a regional or national agency, we ask that you please include not only your regional or national board, but also your local advisory board who informs decisions that are made in Winnebago County. This COVID-19 question, is meant, this particular question is directed at your agency operations overall. There is another COVID-19 question that's related to your program proposals that will be later in the application. Here we're just asking for the name of your program proposal. And then we get into some specific target populations and priorities and intended outcomes that you're seeking, to achieve. What is key to note for this section is that you may choose multiple target populations and multiple priority areas. However, if you are including all of those in one program proposal, there is an expectation that those services be integrated or coordinated with one another. If you have services or priority areas that are separate from one another and will not really relate to one another or be integrated or coordinated in any way, we ask that you fill out separate applications for each program. If you need any clarification on that, please reach out to the info@mentalhealth email address that I will share with you later in this presentation, or attend one of the question sessions. As you go through, you see you can select different system capacity outcomes, individual and family outcomes. There is no specified number of these that you need to select, but we would encourage that you select as many that are applicable and that you are able to measure. Then there's some narrative section here about your program proposal. We get into some more specifics in terms of describing the proposal in a narrative way. COVID-19, how are you mitigating COVID-19? How are you limiting your program to Winnebago County residents only? And this is really key one here, demonstrate alignment with the Mental Health Board's values, specifically the values of collaboration, diversity, being client-centered, trauma-informed, and accessible. And so you will see those values. You can find those on the Mental Health Board's webpage and download those and find more specific definitions of what the Mental Health Board means for each of those value statements. Some narrative about your intended outcomes, including here community outcomes. You're not expected to measure these community outcomes, but we would like to know if you have any data that at an agency level that might be helpful for the Mental Health Board to assess and evaluate these outcomes over time. Here's some questions about clients served and personnel, and there's some good detail and description for each of these. Evidence-based practices, we do expect that all proposals be evidence-based and in accordance with best practices, and we would like you to reference what those best practices are and what research base there is for those practices. Here's the budget, link to the budget template. You'll need to download that, fill that out, save it, and then reload it here as an upload. Okay, so that's pretty much the end of the application is this budget section. So I am going to come out of the screen share and I'm going to enter a budget, which I've already downloaded, but you will need to click on this and download the budget for yourself. So as I go into the budget document here, there'll be on the first tab, a brief description of each of the different types of cost and some definition for those so that you can make sure that you're reporting your proposed costs in the right area. One area to take particular attention to is the difference between direct administrative cost and administrative management in general that is indirect. So direct administration, being administrative expenses that are directly related to the operation of the program, whereas indirect would be more agency level overhead that's not specific to the program itself. And any indirect costs, once again, must be accompanied by a cost allocation plan. or a federally approved rate. Again, if you already have a federally approved rate for cost allocation, you are not required to have indirect cost in your proposal. So that would be an easy way to not have to provide a cost allocation plan, is to not have indirect costs in your proposal. In terms of revenue, we are asking that you report all revenue sources for your program proposal, not for your entire agency, but for your program proposal, including state, federal, other types of revenue, and then ultimately the amount that you are requesting from the mental health board. And to the best of your ability, if your program proposal crosses over multiple priority areas, we'd like to see what those revenue breakdowns are by priority area. So again, I know that's not always going to be cut and dry, but to the best of your ability, if you could give us the estimates of how much of that funding is allocated into each priority for your program proposal, that is greatly appreciated. And the same thing on the cost side of things, if you could break the cost into those 4 priorities, and then also into the different types of cost, these breakdowns that are defined in that first tab that we covered earlier. Certainly, if you have any questions about this, please bring them with you to the information sessions or reach out to the mental health board at the info@mentalhealth email account. I'm going to go back to the presentation now, and we will finish that up. So the grant rubric is linked in the acknowledgements of the grant application, and you can see the different criteria and how it will be scored and what the board is looking at specifically as it relates to the scoring. I'm just going to briefly overview the different sections that the board will be taking a look at. That includes the agency description, again, like risk management, how is that being mitigated, cultural competency, trauma-informed, accreditations, credentials, and alignment with board's mission, vision, and values. Proposal description, what are you trying to accomplish? And really the critical thing for proposal descriptions is how well does it align with the board's 3-year strategic plan? It is really critical that the program match the priority service areas and target populations and intended outcomes described in the 3-year plan. In terms of outcomes, again, getting to that intended outcomes, alignment with the plan is important, but also we want to know what are your current methods and or anticipated methods for collecting this data, and how are these measures in alignment with evidence-based, research-based practice. For the proposal budget, really just looking at ensuring that everything's put into the right category and looking at those overall administrative to direct cost rates or indirect to direct cost rates, and ensuring that there is compliance with an indirect cost allocation plan if there are indirect costs associated with the application. For future years, the board will be considering performance in a funded year as to how that might relate to the board's desire to fund for future years. So I'm just putting this criteria up here so you can see things that you might consider as priorities for this particular program year to position your agency well for potential future year funding. And again, one of the things I'll highlight here is participation in the Mental Health Board's Learning Network Collaborative, which will be a requirement of all funded agencies. And then of course, reporting compliance, which includes those quarterly reports and also financial, end of year financial and program reports. Please do not hesitate to reach out if you have any questions at the info@mentalhealth.wincoil.us for any technical questions you have in terms of your proposal or just being able to use the grant portal. In addition to that, there will be scheduled information sessions on January 20th and January 27th. For those who have already signed up for email updates, you will receive the registration information emailed to you. If you're not signed up for email updates, you can reach out to the info@mentalhealth email account and ask for the registration information if you're interested in attending. And we certainly encourage if you would email us any questions you have ahead of the information sessions so that we can be prepared for those sessions. So I hope this was informative for you, and good luck in your application process.